Hello everyone, welcome to my channel Physiotherapy Online Lectures. Today we are going to study abnormal gait. So in the previous video we have studied about the normal or typical pattern of gait and its phases, determinants of gait, and in today's video we are going to study abnormal gait, which is atypical gait or known as the pathological gait. Okay, now next slide. There are numerous causes of abnormal gait. There can be great variation depending upon the severity of the problem. It may be due to any muscle weakness, huh, or due to the joint motion which is limited by any cause. Joint motion means range of motion which may be limited due to any cause. There may be for that the abnormal gait occurs, and if there is a muscle weakness from that also causes the abnormal or pathological gait. Now, the pathological gaits, abnormality in gait may be caused by number one, pain, number two, joint muscle and range of motion limitation of the joint, number three, muscular weakness or paralysis, number four, neurological involvement just like upper motor neuron lesion or lower motor neuron lesion, and number six is the leg length discrepancy or LLD. Now, types of pathological gait are not the types. Number one is the due to pain. Due to pain, the gait is antalgic gait or limping gait. Antalgic gait is also known as the limping gait, that is squatting gait. Next point is due to the neurological disturbance or neurological causes. Under the subheading of the neurological causes, number A is the muscular paralysis, both limb, that may be spastic gait, that is spastic gait is also known as the circumdactyl gait, Caesarean gait, dragging gait, or robotic gait or quadriplegic gait, and subtype is another is placid. This is the spastic is the upper motor lower motor neuron type, and placid is the upper motor neuron type. That is, in placid gait you will see the lurching gait, waddling gait, gluteus maximus gait, quadriceps gait, or foot drop gait, or high stepping gait. Next cause is the cerebellar dysfunction. In cerebellar dysfunction you will see the ataxic type of gait or ataxia. Next one is the loss of kinesthetic sensation, that is stamping gait. Next, basal ganglia dysfunction, fascinating gait. This fascinating gait is seen in the Parkinsonism disease, the fascinating gait. Another subtype due to the abnormal deformities. Any congenital or abnormal deformities occurs due to any cause. In this, the equinus gait, equinovarus gait, calcanean gait, knock and bony gait, genu recurvatum gait. Last one is the due to LLD or leg length discrepancy. In this, you will see only the equinus gait. So, we will study lab number one, that is the antalgic gait. In antalgic gait, this is a compensatory gait pattern adopted in order to remove or diminish the discomfort caused by pain or in the lower limb or in the pelvis. Mainly the antalgic gait, this antalgic gait occurs due to the discomfort caused or by pain in the lower limb or pelvis. Okay. Now, number one characteristic features is the decreased in duration of stance phase. If in antalgic gait, the stance phase, which is 60%, the duration of the stance phase will be affected by the pain in your lower limb. So there is decreased in duration of the stance phase occurs of the affected limb. There is unable to weight bear due to the pain. Next one is there is a lack of weight shifting. Lack of weight shifting. This is right leg. This is left leg. Okay. So in case of gait or walking pattern, you will see there will be weight shifting when you are walking, weight shifting towards right or weight shifting towards left. You will see. Okay. So there will be lack of weight shifting laterally over the stance limb. The stance limb means that limb is supported, single limb supported. So there will be decreased in weight shift pattern. Okay. There will be decrease in stance phase. Affected side will result in a decrease in swing phase of the sound limb. Okay. Next one is the sciatic gait. Psoas bursa may be inflamed or edematous. Psoas major and psoas minor. In this psoas bursa may be inflamed and edematous, which may cause limitation of movement due to pain and produce a atypical gait. That in this atypical gait, the hip will externally rotated, hip will be adducted, and the knee will in slight flexion. In this process, seems to relieve tension of the muscles and hence relieve the inflamed structure. Number 3 is the gluteus maximus case. So, see, this is the gluteus maximus muscle where we sit during sitting. We will support in the gluteus maximum maximally during the sitting position. The whole support is on the gluteus maximus muscle. The gluteus maximus act as a restraint for forward progression. In this, the trunk quickly shifts posteriorly. The trunk is shifted posteriorly when there is the gluteus maximum inability to act. The gluteus maximum, but in this, the trunk will shift posteriorly at the heel strike. During the heel strike or initial contact is for the RLA. In the previous year, we have studied about the RLA, but heel strike is for the general phases, traditional. Okay. In the trunk will shift posteriorly at the heel strike. This will shape the body's center of gravity. Obviously, if the trunk is shifted posteriorly, then there will be the center of gravity will shift posteriorly over the gluteus maximus muscle, moving the line of force to posterior to the hip. Normally, it lies anterior to the hip. Here, the line of force or line of gravity, which is known as line of gravity, which will lie posterior to the hips. With see in this picture, it is in this position. This is known as the gluteus maximus case. Okay, there is inability to perform the function of the gluteus maximus. With foot in contact with the floor, in contact with the floor, this requires less muscle strength to maintain the hip in extension during the stance phase. So this shifting is referred to as the rocking horse gait. Rocking horse gait because of the extreme backward forward movement of the trunk. In normal gait, you will not see the extreme backward forward movement of the trunk, but in case of gluteus maximus gait, you will see the rocking horse movement during the rocking horse movement or backward forward movement. You will see rocking backward forward movement normally in horse. So in rocking horse means running horse. So this movement is also known as the, or this gait is also known as the rocking horse gait. Next one, we go to the gluteus medius gait. It is also known as the Trendelenburg gait. Most important, sometimes in examination, the glute comes is the Trendelenburg gait instead of the gluteus medius gait. Okay, it may come in the exam as the Trendelenburg gait. It is also known as the Trendelenburg gait or lurching gait. When one side is affected, only one side is affected, known as the lurching gait. But both sides gluteus affected as the Trendelenburg gait. Okay, the individual shifts the trunk over the affected side. See, in this picture, the individual is shifting the trunk. This is the affected side. The trunk is shifted towards this one. This is the affected side. Or the trunk is shifted towards the affected side during the stance phase. When the right gluteus medius or hip abductor is weak, it causes two things. The body leans over the left leg, okay, during the stance phase of the left leg, and right side of the pelvis will drop. Here, see, the right side of the pelvis drops during this, during the stance phase of the left side, and this side gluteus medius muscle is weak. The left leg, the trunk will shift towards the left side, body will lean towards the left side, and the right sided pelvis will drop. This is the right sided pelvis which drops towards the affected side. Okay. This shifting of the trunk over the affected side is an attempt to reduce the amount of strength required of the gluteus medius to stabilize the pelvis. It will reduce the amount of strength required to the gluteus medius to stabilize the, in case of bilateral paralysis. The both-sided gluteus medius, that is the walking pattern or gait, will be known as the waddling gait or duck waddling gait. Sometimes exam comes as the duck waddling gait also. In case of Trendelenburg gait, single side, but in case of duck waddling, WADDING, duck waddling. In case of the peasant larch, or it is also known as the lurching gait. Lurching gait. Okay. The peasant lurches to both sides while walking. If what is lurching? See, yeah. If suppose if this side of the gluteus medius is affected during the stance phase of the left side by supported limb. Okay, this is the left limb which is supported in the upper trunk leans towards the left side. Okay, and the pelvis drops here. Okay, if this is one-sided duck, see, and if the affected side is this one, this side during the stance phase, same will be occurs vice versa. So the lateral saw movement of the both side, just like the duck is. That's why it is in case of bilateral paralysis, that is known as the duck waddling gait. Okay, the body saws from side to side on a wide base with excessive shoulder swing. Okay, example, in case of muscular dystrophy, you will see the duck waddling gait. Okay, next one is the quadriceps gait. Quadriceps action is needed during the heel strike, during the heel strike and during the foot flat, when there is a flexion movement acting at the knee. Flexion movement acting during the heel strike or foot flat of the knee. Okay. Now the quadriceps weakness or paralysis will lead to buckling of the knee. You will not able to perform the knee flexion. So there will be buckling of the knee during the heel strike. So patient cannot compensate this if he has normal gait extensor or plantar flexors. Okay. What is the compensation with quadriceps weakness? The individual may lean forward over the quadriceps at the early part of the stance phase or heel strike. Early part of the stance phase is the heel strike, as weight is being shifted on to the stance leg. Normally, the line of force falls behind the knee, normally during the stance phase, requiring quadriceps action to keep the knee from the buckling. But in this case, the line of force will fall forward. That will keep the knee buckling. Okay. By leaning forward at the knee, the COG is shifted forward. The line of force now falls in front of the knee. See, this will force the knee backward and extension. Okay. Another compensatory maneuver to use this hip extensor and ankle plantar flexor is a close chain action of the pull the knee into extension at the heel strike. See, in this case, another compensatory maneuver is to use the hip extensor, that is so yeah, quadriceps and ankle plantar flexors in a close chain position. See, this is in a close chain position. Close chain position to pull the knee into extension. To the here, pull the knee into extension at the heel strike. Okay. In addition, the person may physically push onto the anterior thigh during stance phase, holding the knee in extension. Okay. This is the quadriceps leg. Now the genu recurvatum leg. What is genu recurvatum? Is the hyper extension of the knee is known as the genu recurvatum. When their normal extension, hyper extension of the knee occurs. Hyper extension of the knee is known as the genu recurvatum. Okay. When there is hamstring weakness, hamstring muscle, hamstring are weak, two things may happen during stance phase. The knee will go into excessive hyperextension, referred to as the genu recurvatum gait. And during the deceleration or the terminal swing phase, the part of the swing phase without the hamstring to slow down the swing forward of the lower leg, the knee will snap into extension. See, the knee is snap into extension. Okay, this is the genu recurvatum gait. Now the hemiplegic gait, one of the important hemiplegic gait, the spastic pattern of the hemiplegic leg, spastic pattern. So this side has the spastic pattern of the hemiplegic hand. This is the spastic pattern of the hemiplegic leg. The hip into extension, it is an extension, adduction, and medially rotation. Knee in extension, though often unable to extend the knee. Ankle is in foot drop position. Drop foot with ankle plantar flexion. See here the plantar flexion of the ankle and inversion, which is present during both stance and the swing phase. In order to clear the foot from the ground, the hip and knee should flex. In this, you have to clear the ground. In order to clear the ground, you have to both the hip and knee have to flex. Okay. but the spastic muscle won't allow the hip and knee to flex for the clearance, ground clearance. Okay, but the so the patient hikes the hip laterally. See, patient hikes the hip, bring the affected leg by making a half circle, sidely, just like this, sideward, half circle. That is the circumduction of the leg. So that's why it is also known as the circumductory gait. The hemiplegic gait is also known as the circumductory gait. Okay, due to circumduction, unable to clear ground clearance, the patient wants unable due to unavailability, the patient hikes the hip and bring back the affected hip by making a half circle. That is the circumduction. Usually there will be no reciprocal arm swing. Step length try to lengthen and involve side to side. Now Caesarean gait. In result for spasticity of the bilateral adductor muscle, both sides, right and left, bilateral spasticity of the both adductor muscle. One leg crosses, see, one leg crosses the direction over the other with each step. This leg step will be here and this leg step will be here. So it is normally seen in the cerebral palsy patient. Okay. So that's why uh, the leg crosses each other during the stance and swing phase. So that's why it is known as the Caesarean. It's act like a Caesar. Right leg crosses over the here during the heel strike, and left leg crosses over the right during the heel strike. So that's why it is known as the Caesarean gait. Dragging or paraplegic gait. There is spasticity of the both hip and knee extensor and plantar flexor in case of paraplegia. In order to clear the ground, the patient has to drag his both lower limbs, swing them, and place it forward. Okay. Cerebral ataxic or drunkard gait. Cerebral ataxic gait or drunkard gait. It is abnormal function of the cerebellum. When the function of cerebellum is to what, maintain the normal balance and equilibrium. Okay, the function of cerebellum is to maintain the normal balance and equilibrium of the individual. When there is the abnormal function of the cerebellum, results in disturbance of the normal mechanism controlling the balance. Therefore, the patient works in a wider base of support. Patient works in a wider base of support. This wider base of support creates a larger side-to-side deviation of the center of gravity. Normally, the center of gravity lies here, but wider base of support will shift here one side. This sometimes it will shift here. So that's what. This results in irregularly swinging sideways to a tendency to fall with each other. Hence, it is also known as reeling gait or drunkard gait. Normally, drunken people walks like this, ataxic gait, drunkard gait. Drunken people walks like this. Okay. Sensory ataxic gait. It is a typical gait pattern seen in the patient affected by tabes dorsalis. Is a one condition occurs due to the cerebellar dysfunction and sensory dysfunction of the cerebellum. It is degenerative disease affecting the posterior horn cell, the posterior column of the spinal cord. So the tabes dorsal is a degenerative disease affecting the posterior horn cell and posterior column of the spinal cord. Because of this lesion, the proprioceptive impulse won't reach the cerebellum. Due to this lesion in the posterior horn cell or posterior column of the spinal cord. The proprioceptive impulse, which comes from the posterior hansel and reaches the cerebellum to act like the in this lesson, the proprioceptive impulse does not reach the cerebellum. The patient will lose his joint sense and position. One of the important function of the cerebellum is to joint sense and position of the limb on space during the swing phase. Okay, the position of the limb on space. Because of loss of joint sense, the patient abnormally raises his leg high step. Abnormally, he or she doesn't have any joint sense or how much he has to lift. So abnormally patient in this case abnormally raises his leg height. Okay. Jerk is forward to strike the ground with a stamp. So this is also known as the stamping gait. The patient compensates this loss of joint position sense vision, so his head will be down while during the walking. Now, short suppling gait or fascinating gait. Short suppling gait or fascinating gait, it is seen is the Parkinsonism disease. Parkinson's disease. Okay, PD. PD also a terminology of postural damage. The Parkinson's disease in Parkinson is a later stage. This gait is seen the short suppling gait or fascinating gait. In this, normal function at the basal ganglia are at the control of the muscle tone, planning and programming of the normal movement, control of associated movement like reciprocal arm swing. Typical example for basal ganglia lesion is the Parkinsonism. Because of rigidity of all the joint that will go for the flexion position, the spine stooping forward. See, the spine stoops forward. This posture displaces the center of gravity. Obviously, the center of gravity shifts anteriorly. So, in order to keep the center of gravity within the base of support, the patient will know of short suppling steps. Due to loss of voluntary control over the movement, they loses balance and walks faster as he is chasing the center of gravity. So it is also called as the fascinating gait. Since his suppling steps, it is otherwise called as the shuffling gait. Okay, so this is seen is the now the foot drop gait or slapping gait. It is due to the dorsiflexion weakness caused by the paralysis of the common peroneal nerve. There won't be normal heel strike. Instead, the foot comes in contact with ground as a whole with a slapping sound. So it is also known as the slapping. Or it is also known as the foot drop gait. In foot drop gait, you will see in the outdoor, the foot drop gait patient normally works with a slapping sound. Okay. Due to plantar flexion of the ankle, there will be relatively lengthening of the leading extremity. The extremity will be lengthened. So, to clear the ground, the patient lift the limb too much high. To clearance of the ground, the patient lift the limb too much high. Hence, the gait has another name. The foot drop gait has another name, that is high stepping gait. Okay. Now equinus case. Equinus means horse. Okay. Because of paralysis of the dorsiflexor, which results in the plantar flexor contracture, the patient will walk on his toes. The patient will only walk on his toes. In case of equinus case, when the patient walks on his toes, that is the equinus position, horse position. Other cause may be compensation by the plantar flexion for a short leg. Okay, unequal leg length or leg length discrepancy or LLD. We have unequal leg length, usually a discrepancy of approx 1/4 inch between the right and left leg. 1/4 inch. There will be shorten of the leg. Suppose the right leg is of 10 centimeter, the left leg is of 8 centimeter. So there is a approx 1/4 inch a discrepancy. So this is left leg, this is right leg, and the length of the leg will be 10 centimeter and 8 centimeter. That is normally, usually it doesn't happen, but when it's happened, that is unequal leg length or leg discrepancy occurs. Leg discrepancy. Minimal leg there will be divided into 3 types: minimal leg discrepancy, moderate leg discrepancy, and severe leg discrepancy. And minimal compensation occurs by dropping the pelvis of the affected side. The person may compensate by leaning over the shorter leg up to 3 inches. Okay, can be accommodated with this technique. Moderate, approx 3 to 5 centimeter. Dropping the pelvis of the affected side will no longer effective. A longer leg is needed to the person. Usually works that you will see in the equinus gait. When there is foot drop, same gait pattern occurs. Okay, and last one is the severe LLD, which is more than 5 inches. When the discrepancy difference between the two leg length is more than the 5 inches. A person may compensate in a variety of ways, such as the dropping of the pelvis and walking in an equinus gait plus flexing of the knee. It is addition. Flexing of the knee on the uninvolved side often used to gain an appreciation for how this may feel or look. Walk down the street with one leg in the street and the other leg sidewalk. That is the severe LLD. Okay. Now, equinovarus gait, there will be anterplantar flexion and subtalar inversion. So the patient will be walking on the outer border of the foot in CTEV. The spelling has been misdirected. It is in CTEV. It will be CTEV. Congenital talipes equinovarus. In this disease, it is a congenital disease of the leg. In this disease, this equinovarus gait type you will see. Now, calcaneum gait result from the paralysis of the plantar flexion causing the dorsiflexion contracture. The patient will walk on his heel only. In case of equinus gait, walks on his toes only. In case of calcaneum gait, walks on his heel. So beneath the heel, that bone is the calcaneum bone. It is characterized by the patient will be walking on his heel only. It is characterized by greater amount of ankle dorsiflexion and inflection during the stance and a shorter step length on the affected side. Single limb support duration is shortened because of the difficulty of stabilizing the tibia and knee. Okay. Now, knock knee gait, it is also known as the genufalgum gait. Knock knee, both sided. It is known as the genufalgum gait due to decreased physiological valgus of the knee. In case of severe OA knee, in case of severe or grade 4 OA knee, this knock knee gait or genufalgum gait is same. Due to decreased physiological valgus of the knee, both the knee face each other, widening the base of the support. Okay, and bow leg just opposite. It is Now nocti is like this, bow leg will be like this. Okay, bow leg, knee face outwards. So the knee faces outwards in the bow leg. Due to increased physiological valgus of the knee, the legs will be in board position. Increased physiological valgus, the leg will be in, the ankle will be increased. Okay, and one picture, both the traditional and rancho los amigos stance phases are there in this picture. You can see this is the traditional phase, will strike distance push off, and this is the rancho los amigos initial contact to distance position. Okay, next this you will see the whole gait cycle, how much percentage it bears. Right initial contact is 0%, right foot flat it's 7%. In this 7%, left toe off is 10%, right mid stance is 30% of the whole gait cycle, right sided heel up is 40%, left initial contact is 50%, and right toe off is 60%. Okay, okay, thank you.